The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. My name is Frank Smith. I am a family practice physician assistant, and today we're going to be discussing the basics of type 2 diabetes. If you've recently gotten this diagnosis, you've had a flood of information coming to you from your clinician, your friends, your family, and whatever you've read on the internet. But one of the things that can get lost in the middle of all this information is the basics of what type 2 diabetes even is, and we're going to cover that today. Let's start with some basic physiology so we can really understand what's going on. Every cell in your body runs on glucose, sugar. It is the fuel that drives the engine within the cell. But in order for that sugar to get into the cell, there is a substance created by your pancreas called insulin. Insulin is what allows sugar outside the cell to get inside the cell so that the cell has fuel to run on. The irony is that sugar outside the cell is toxic, it is poison to the cell, while it is fuel inside the cell. In type 2 diabetes, the cell starts to become more resistant to insulin's effects. It becomes less willing to open a channel which allows sugar into the cell. So levels of sugar inside the bloodstream start to climb and climb and climb, which poisons the cells. Meanwhile, the cell is getting very little fuel. The analogy I usually use with patients is, if you imagine you pull your car up to the gas station and you take the gas nozzle and put it in the fuel filler neck of your car, the engine has plenty of fuel and runs well. If you were to pull up and you can't get the gas cap off, so you decide instead to open the back door of your car and just spray gasoline on the inside of your car, the engine's getting no fuel and you're ruining your car. That, in a nutshell, is what uncontrolled type 2 diabetes is. No fuel in, but fuel outside. So how did this even happen? Usually on type 2 diabetes, it's a combination of genetics and environment. On the genetic side, if you've been diagnosed with type 2 diabetes, odds are very high you know a family member who already has type 2. That insulin resistance tends to have a genetic component. On the environment side, it comes down to our dietary choices and how active we are. If we are continually flooding the body with sugars and starches, it makes it more likely that the body will have a hard time metabolizing that because you're asking the cell to respond to insulin over and over and over, and after a while, it starts to become resistant. The lifestyle side, anytime we ask a cell to increase its metabolic rate to really ramp up what it's doing, in order for it to get enough fuel, it becomes more sensitive to insulin. If we have a lifestyle that we just don't do a whole lot, cells can become a bit sluggish and become more resistant to insulin. So it's a combination of your genetics and lifestyle. As far as treatment, your clinician has almost certainly already talked to you about medical options. There are innumerable medications to treat diabetes, and it's far beyond the scope of this little show to discuss all of the meds that are out there and how they work. Suffice it to say, though, we have a lot of options available to us. But the biggest thing that can be done about your diabetes is really in your hands. It is what you do. Diet and exercise is something that we talk about on every patient that comes in. Diet and exercise, diet and exercise, diet and exercise. And it's true. What we take into our bodies and how we move our bodies has an impact on our health. But I would argue that there is no medical condition that it has a bigger impact than diabetes. On the diet side, it's pretty straightforward, isn't it? If our bodies are already having problems handling sugar, We want to limit how much of that we're taking in so our bodies don't have to fight it every single waking moment. One of the other things to really watch out for, though, are starches. Examples of starchy foods include things like rice, potatoes, bread, pasta, and cereal. The reason why you will hear us talk so much about your starch intake is all a starch molecule actually is an extremely long chain of glucose molecules tacked one after the other. And when it hits the digestive system, the body almost immediately goes in and floods the body with all of that sugar, the very thing we're not wanting. So we really need to watch both our sugar and starch intake. On the exercise side of it, I've already kind of touched on that. When we ask our cells to really ramp up their metabolic rate, when we put the throttle down, they need more fuel. And one of the things that happens on cells when they increase their metabolic rate is the cell becomes more sensitive to insulin. And that sensitivity isn't just limited to while that cell is being actively working. It continues for quite a while past that. So when you exercise, you're increasing the cell's sensitivity to insulin. It becomes easier for fuel to get inside the cell, and we have less fuel poisoning the cell from the outside. So that's it in a nutshell. That's what type 2 diabetes is. Fuel outside the cell without enough fuel inside the cell. The cell doesn't run well and it's being poisoned. That's the basics of what's going on. When you have all of this information coming at you, glycemic index, hemoglobin A1C, carbohydrates, all of these things being thrown at you, the thing I want you to remember at its core, this is simply too much fuel outside the cell, not enough fuel inside the cell. That is your type 2 diabetes. If your clinic has a certified diabetic educator or a nutritionist, make use of their services. Some health insurance plans have it as a benefit as well. Check into that. Certified diabetic educators and nutritionists are a wealth of information. And in diabetes, the more you know, the better you're going to be able to effectively attack this. Like the tagline of the show, understanding is part of healing. Understanding your diabetes is step one in fighting this. So that's going to do it for this week's show. I hope you have found it entertaining and informative. If you have, please click the like and subscribe button down below. I'll see you next week. Until then, get better and make me look good. Bye.